So you'll be told over and over that there's far less aluminium in vaccines than there is in infant formula and in breast milk. And they will give you the amounts in breast milk and infant formula, and I'll give you those in a little while. But the problem is that there's several problems. First off is that you're getting different doses all at one time. So while you are getting some aluminium in breast milk and formula, you're getting a little bit every day. When you get a vaccine, you're getting a huge dose through the skin into the muscle all at once. Okay? So we cannot compare injection with eating and drinking or ingestion. Okay? So the real question is, how much can a baby safely handle at one time from any route? Well, when aluminium is injected, what happens? They say that it leaves the body really rapidly. Remember, Oxford said leaves the body really rapidly, but it doesn't. We have several studies that prove that it doesn't leave the body really rapidly. And I'm going to be going through these studies. So you can take as many pictures as you want, but know that I'm going to be much more descriptive. So we have a rabbit study that showed that most of the aluminum still stays in the body after 28 days. We have a baby study that shows none of it came out. And we have another study that they used to show you that it's perfectly fine to inject. Only problem is that they used healthy adults, and they gave them the most minuscule dose. It's kind of a strange term. They gave them a minuscule dose, a very, very tiny dose, far lower than they give babies. And they gave it intravenously, which is completely different to when you put into the muscle. And I'll tell you why in a minute. So this is what they rest on, this last study, when they tell you it's fine. And I'm telling you, these studies show you that it does not leave the body rapidly at all. So let's see what happens in rabbits. We have this one study where they put in a pretty big dose of aluminium into the rabbit, into the muscle. And then they looked to see how much of it appeared in the blood and how much of it appeared in the urine. And then they killed the rabbits 28 days later, and they looked to see how much of it was deposited in different organs in the body. So if they get rid of it really quickly, we should see a lot of it in the urine, right? Well, it turned out that most of it, 94% was retained of the aluminium hydroxide, because only 5.6% came out in the urine over 28 days. It's all stayed in the body. Here, 78% was retained because only 22% of aluminium phosphate came out in the urine over 28 days. So we know already that Oxford University is lying, because we have animal studies that show that it does not come out, is not rapidly excreted in a matter of just a few days. So where did it go? Well, when they killed the rabbits, they found that it went to all of these organs, okay? Very high concentrations in the kidneys, and then lower, a little bit less in the spleen, liver, heart, lymph nodes, and brain. Okay, now brain might have had the smallest amount of all, but remember, the brain is a very sensitive organ, so you don't need very much aluminium to cause big problems in the brain. So this is where the aluminium goes immediately after 28 days. But over long term, we know that it goes also into bones, which is why when a mother is having a baby, making a baby, that she's dissolving her bones to give minerals, that she's also going to give that aluminium. It's another reason why mothers really should be eating high mineral diets when they're making in utero baby, because then they will need less of their own minerals and they'll have less of this bone. Okay, so it's very important for mothers to have good nutrition, high minerals when they're having gestation. Well, this is a really interesting study from the USA, and this doctor decided to see what happened to the aluminium in a 2-month-old baby after the regular vaccines were given. Okay, so at 3 months, these babies get a series of vaccines, which have a total of 1,200 micrograms of aluminium. So they gave this regular dose, and then they measured the amount of aluminium that came out of their body over 12 hours. And if it is rapidly excreted, we should see it in the urine, and we should also see blood levels rise. But what they found was that, quote, there was no significant change in levels of urinary or serum aluminum, blood aluminum, after vaccination. So this was a very strange conclusion, and I had to read the study several times before I could comprehend why it was even published. But they also said that they were, I'm trying to give you the exact words, reassured to find that there was no significant post-vaccine rise in the blood aluminium after the vaccination. And I thought, why were they reassured? We want to see that it rises in blood and that it comes out in kidney, because that's how it happens. You have to have it in the blood before it can get into the kidney. But they said, oh, we were reassured. We didn't see anything go up. And so I wrote to this author myself, and I said, well, where do you think this might have gone? What do you think happened? And she said this to me in an email: we really don't know what happens to the aluminium at this point in time. As you said, more research is needed in this area. So on the one hand, she was reassured, and on the other hand, she has no idea where it went. I wrote back to her again, asking her several other questions and pointing out to her how newborn babies' kidneys deal with this problem, because I'm a kidney doctor, and I did not hear back from her. She probably Googled my name. So we're also told that aluminium is harmless, because any aluminium that doesn't go into the blood and dissolve stays right at the injection site. So first of all, that is completely untrue. So if anybody ever says this to you, know that the way the aluminium and the antigen are together when you inject it comes right apart after it is injected, okay? And they have proved this time and again in many different studies. And what happens after you inject this aluminium is that there's these cells called macrophages that are part of the immune system. And they come in and they eat this aluminium. And they also eat the antigen. And this is how they want it to happen. Vaccine designers want this to happen, because what happens is the aluminium stirs up, calls in all of these cells to come in and become immune to this antigen and bring it off to lymph nodes and communicate with the rest of the body to make immunity. So they want this to happen. It's not a mistake. So these macrophages come in after the injection, eat the aluminium, and then this is where the Trojan horse comes in, because we know that there is a natural phenomenon that these macrophages can carry whatever they eat into the into the brain, past that blood-brain barrier. And how do we know that? Because we have this study done in 2012 which proved it. And this would be called a proof of principle experiment, meaning they wanted to show that if they loaded these macrophages, in this particular experiment, they loaded them with, I think it was gold, silica gold, and then they injected them into the tail of a mouse, and then they watched where it went, and they found it in the brain. And they said, this is great, because now we can pack these macrophages with anti-cancer drugs and treat brain tumors. So they are taking advantage of this natural phenomenon in order to treat cancers. So I'm telling you that it's proven because they're using it therapeutically, but it also happens with aluminium, and there's nothing therapeutic about bringing aluminium into the brain, ever. So there is this doctor that did an experiment with mice proving that aluminium goes from the muscle to the brain. So it's already been shown very recently. And every pathway from injection to traversing into the brain has been shown scientifically at this point in time. So they know that when they put a radioactive substance onto aluminium so they can track it, okay? It's only just so they can track it. They find that it quickly goes into these macrophages, and then it goes into the lymph nodes, and then it goes into the blood, and then it goes into the organs, including the brain. And that there is a transporter called CCL2 that brings this aluminium into the brain. All right. So these doctors, this is a very important paper that I'm putting here for you, because they are basically saying that we should not over-immunize, whatever that means, and that if there is ever any sort of alteration in the blood-brain barrier, this aluminium can be extremely problematic. So there are many things that alter the blood-brain barrier. You know, when premature babies do not have, okay, blood-brain barrier, let me explain to you, is capillary cells, pretty much, that line the brain. They do provide some sort of a wall from, you know, large molecules and some toxic things and from some cells getting in. But there are ways to get around that. One of the ways is to open up the blood-brain barrier. And so there are many known commonly prescribed and common infections that can open this blood-brain barrier. So methamphetamine, which many people in the world are addicted to, opens the blood-brain barrier. This is something that's released during infection. Complement can open the blood-brain barrier. Radiation that's given therapeutically for cancers or being out in the sun for a very long time can open the blood-brain barrier. Problems with mitochondria, which are extremely common. Infections. Formula, infant formula. Because what happens with infant formula is that not only are you not getting all the good nutrients from the mother, but you're also changing the intestinal contents. It's very basically making more E. coli and the bad bacteria populate than the good bacteria, the probiotics. So it's not just premature birth. Lots of things can open that blood-brain barrier. And then these vaccines that are given all throughout life, that aluminium can get into the brain. So you can now understand why this is a very easy argument to win when it comes to aluminium. So there's enough evidence to show that vaccine aluminium gets into the brain even when we're told that it doesn't. They have actually photographed these particles in the brain after they inject them into the muscle. Okay? Here's a photograph from the same article, Khan, I've been showing you. And so this here is a particle of aluminium in the brain. And then they showed, by doing this kind of fancy analysis, that even at 1 year, they're still finding high levels of aluminium in the brain. All right? So they've not only taken pictures, they've measured it, and they've shown how it travels from the muscle to the brain. This is the title of the article. I believe this is free. All of these, this PMID number, you can go to PubMed, PUBMED.gov, G-O-V, from the United States. And you can put these numbers in and you can get the article. You might not get the whole article, but with this one I believe you do get the full article. Some of them you just get the beginning, introduction.
What do you want to say it again?
PUBMED.gov. You could just put PubMed into Google and you can find it. So this is very useful. So aluminium just doesn't come into macrophages, but we also have found it in T cells, the major cells that fight disease in your body. And so what we can see here from this doctor, Dr. Mold, in 2014, when he put these T cells in a dish with aluminium, he found that this is without the aluminium. Then he added the low-dose aluminium and the high-dose aluminium, and these arrows, these bright spots, are aluminium. The blue is the nucleus of the cell, showing you that it's a T cell. So these dots, these very bright dots, are showing you from this study that T cells also take up aluminium. But the people, what we call the vaccine stakeholders, the people that want to defend vaccines at any rate, will keep telling you about two studies. I already talked about these a little bit. From 2002 and